The Biden administration's key program to help vaccinate the world is in danger of grinding to a halt. What does this mean for the African continent?
Thank you. The Biden-Harris administration have been really, really excellent so far in their response to not just Africa, but to the global, the understanding the global needs and understanding that this pandemic affects us all, and that unless all of us are protected and all of us are vaccinated, none of us are safe. So it is a shame, and it is sad to see that there are political hindrances in the way. Of course, I can't speak to the politics of the matter, but what I can say is that the help to Africa so far has been invaluable, both bilaterally to countries on the African continent, including Kenya, Nigeria, and others, and also multilaterally through COVAX, which is the vaccine pillar of the ACT Accelerator, of which I'm special envoy and co-chair.
Now, Dr. Alakija, what are your thoughts on what the WHO revealed, that up to 65% of Africans have had COVID? Those are maybe even a small estimate that it's likely more than 100 times more have not been reported. You know, Africa has always been said to have, gotten away from the whole, scourge of the COVID pandemic that has hit so badly in the Western world and Asia.
That's a great question. I have been saying, and many of us have been saying for months, for over a year now, that we were flying blind on the African continent. Nobody knew whether people had COVID or not. Everybody was going about their own business because there were no tests, because this issue of diagnostics equity that I've just spoken about, in Abuja, in Nigeria, where I am today, in Lagos, it costs $100 to $150 for a single test. How many people can afford that? People were testing just for travel. There was very limited availability of what we call rapid self-tests, that can easily help you if you're going out, do a quick swab and check to see what your status is. We haven't had access to those. So when the world was saying, oh, Africa has gotten away with it, I've been very vocal about saying that had COVID started on the African continent, the world would have locked us away and thrown away the key, because clearly the value of a life in Nairobi, or the value of a life in Kampala, or the value of a life in Lagos or Kinshasa is worth far less than the value of a life in DC, in London, in New York. So I believe that when we go and look at excess deaths after this pandemic, once it's all done, there's going to be a huge reckoning. I think we as African people have been too complacent about this, and therefore the rest of the world cannot value what we ourselves do not value and hold dear.
In terms of exposure prediction, the World Health Organization said that 2/3 of all Africans had been exposed to COVID-19. This could mean that in September 2021, rather than the 8.2 million, I believe, that were infected, it could have been then 800 million infections, if I'm not mistaken. Could you shed a bit of light on that exposure rate, and maybe even go further and tell us what your predictions are in terms of a year from now with this pandemic?
Look, I think there's nothing really that surprising about that rate, because we've seen it all over the world. We saw it. Look, let me give you some testing statistics. Nigeria, in total, the entire pandemic, had conducted about 4 million tests. The US, as of the same date, had conducted over 1 billion. That same week, the UK was conducting 6.6 million tests per week. You can't measure what you don't count, what you're not testing for, because you're not counting it. So yes, the whole world. I mean, if you look at how people are crammed into buses in Nairobi or in Kinshasa or in Lagos, I think us and our public health leaders and our political leaders wanted to show that, no, Africa is doing okay with this. It's not that Africa didn't do okay, it's just that it's a pandemic.
It doesn't seem like the death rate is as high on the continent. I went to Burundi, I went to Nairobi, but their morgues and their hospitals are not showing the death rate as high as it is in the West. Why is that? Do they have a variant that doesn't kill as many people? Or because if there were such a high death rate, we would see it. We would see constant burying of people.
maybe you can answer it together with Auriane's questions. What are your expectations going forward for the continent in terms of vaccine equity you talked about earlier and the mobilization of support for resources?
In terms of the death rate, I think that is a very dangerous place to go in terms of assumptions, and I tend not to go there. I think we have cultures across Africa who bury immediately the dead. There was times in parts of various countries in Africa where there were overflowing mortuaries. I think what you saw in the Western countries, going back to the metric by which we measure, what you saw was a lot of hospital admissions. We don't have those in Africa. So unfortunately, our deaths, would have been a lot more unnoticed, like I said earlier on. In terms of predictions for the future for Africa, I think there's also another point we haven't talked about. COVID is not just one and done. It's not a binary equation. It's not somebody dies or they don't die. There is also long COVID. And my concern is how many more of those, especially of the young, your 18 to 40-year-olds, how many young women across Africa are today struggling with looking after their kids and going to work? What is it going to do to our workforce? What is it going to do to the economically productive segment of our society? And we don't have access to Paxlovid. We don't have access to other antiviral drugs. We don't know as a continent. So our political leaders, to my mind, are following the drumbeat of the West. Oh, take off your masks. Stop your social distancing. But it is dangerous. And my message is that it's not over. It is not over. We wish it were, but sadly it is not. And we need to keep protecting ourselves and our populations.